In this video, I'm going to describe one of the most deadly diseases of poultry that is termed as coccidiosis, which is very important in terms of poultry production. So, we are going to start our today's lecture with introduction of this disease. Coccidiosis is a protozoan parasitic disease that can cause severe losses in poultry, not only in terms of meat but also in egg production. It is distributed worldwide, not only in poultry but also the game birds reared in captivity and the wild birds. Coccidiosis is caused by protozoa of the phylum Epicomplexa, family Emiridae, and genus Emeria. This parasite infects various sites in intestine. The life cycle of this parasite is 4 to 7 days. The infectious process is characterized by the parasitic replication in host cell with extensive damage to the intestinal mucosa. As this parasite multiply in the intestine, so it causes tissue damage, lower feed intake, poor absorption of nutrients, dehydration, and blood loss through feces. Usually, it is a disease of young birds, but birds can be infected at any time if never been exposed before. Coccidiosis lowers the immunity of the birds, and in this way, this disease invites other bacteria to cause the secondary infections in the bird. These parasites are host specific and site specific, meaning that these parasites only infects the specific animal and at the specific site, as we have discussed earlier that it infects only intestines in case of poultry. Another major point of this disease is that the parasite infects the chicks reared in litter more than those which are reared in cages. Now, if we talk about the etiology of this disease, we have 7 different types of emeria that cause infection in chickens. Emeria acervulina, Emeria maxima, Emeria tenella, Emeria nicatrix, Emeria mitis, Emeria bonoti, Emeria precox. This disease clinically occurs only after the ingestion of relatively large numbers of sporulated oocysts. Both the clinically infected and the recovered birds shed their oocysts in their droppings, which contaminated feed, dust, water, litter, and soil. We already know that coccidiosis is caused by a parasite called as coccidia. So the life cycle of coccidia takes about 4 to 7 days to complete. If we discuss the transmission of this parasite, we already know that infected chickens shed their oocysts for several days or weeks. These oocysts may be transmitted by mechanical carriers such as equipment, clothing, insects, farm workers, and other animals. Moving on to the pathogenicity, we know that Emeria nicatrix and Emeria tenella are the most pathogenic in chickens because schizogony occurs in the lamina propria and crypts of small intestine and ceca respectively and causes extensive hemorrhage. Most of the species develop in epithelial cells lining the villi. Clinical signs of this disease include anorexia and less water intake, decreased growth rate with high percentage of visibly sick birds, weight loss, severe bloody diarrhea, development of curls, decreased egg production, and high mortality. Here you can see the bloody feces from a bird suffering from coccidiosis. This bloody feces is because of a severe kind of enteritis, and here you can see the dehydrated chest of bird and high degree of anemia. The hemorrhages in intestines are petechial and can be seen through the intestinal wall. Diagnosis of this disease is done by case history, lab testing, and doing the necropsy of several fresh specimens. In case history, you should know the severity of lesions, flock appearance, morbidity, daily mortality, feed intake, growth rate, and rate of lay. While the laboratory diagnosis is done by demonstration of oocyst in feces or intestinal scrapings. Necropsy of several fresh specimens to determine the infective Emeria species agent by location in the host and appearance of the lesions. Subclinical coccidiosis is not so much important, but poor performance can be observed in the affected flocks. Practical methods of management cannot prevent coccidial infection. Poultry that are maintained at all times on wire floors to separate birds from droppings have fewer infections. There are two methods of control. One is management and the other one is vaccination. Management has always been important to coccidiosis control, especially before drugs are available. It focuses on reducing the number of coccidia to keep infection at a minimum until the immunity is established. Management is applied through natural immunity, early detection, production system, brooder and grow out management, sanitation, and litter management. When there is a low level of exposure to the coccidia, it will permit the chick to develop natural immunity without triggering the disease. With early detection, you can avoid the use of preventive medication. With early detection, you can treat the small number of birds with the rescue drug or by managemental change. You can detect the disease earlier through the drop in feed intake when it goes down in early stages of coccidiosis. When you have high density and large scale production, you always require the use of anticoccidial medication. If the chicks are brooded and grown out in the same facility, they seed the area with coccidia. These birds may require a low density or possibly the medication. Disinfectants are not effective against coccidia, but they will focus on good hygiene and removing the infected droppings to control the coccidiosis. In litter management, you should keep the litter dry to reduce the sporulation of oocysts and remove any wet or crusted litter. Second method of controlling this disease is using vaccines which are available in low doses of live sporulated oocysts which can be administered to 1 day old chicks either at hatchery or on the farm. But because the vaccine serves only to introduce infection, chickens are reinfected by progeny of vaccine strain on the farm. The self-limiting nature of coccidiosis and the low dose of oocysts are considered a replacement of biologic attenuation. And that's all with our today's video lecture. We'll surely come back to you with another veterinary topic. Thank you.